that this system is broken and needs to be fixed. So we're all here today because we believe in building a solution to secure our families and our future generations' health and economic recovery. With that said, I would like to welcome the newest Southern California Member of Congress, the Honorable Judy Chu, who has long been a champion in our community on issues of health access and working on the ground to improve damage living conditions and
Well, I'm Judy Chu, and I'm the congressional member of the 32nd Congressional District, and I've been immersed in healthcare reform. In fact, I just had a town hall. I'm going to have another town hall at the end of the month, and I wish the naysayers that are against healthcare reform could come here and witness what is happening here and what has happened here for the last 7 days. Today is the last day of the remote area medical LA clinic, and what you see here are thousands of people, 10,000 people total, that have come here who are of all races, all ethnic backgrounds, from all communities, and are people who both don't have insurance as well as have insurance, who've come here desperately in need of health care. They represent what is wrong with our country and why we need healthcare reform now. Today, we see 1,500 people, and every day there have been 1,500 people that have lined up as early as 3 a.m. in the hopes of receiving health care, even 2 hours before the doors open. We would think that this would be the case in third world countries, but no, we're right here in the midst of our nation's second largest metropolitan area, and the clinic is filled to capacity every day. Now, if that's not proof that our nation is in dire need, then I don't know what is. We need quality, affordable health care. We need security, stability, and peace of mind for Americans, and I believe the best way to do that is to make sure that our health care reform bill is passed, and that it includes a robust public option. Now, I can't stress how important this bill is. Certainly, it's important for California, where 20% are uninsured, but it's really important for my district, where 33% of the people are uninsured. Nonetheless, this bill goes beyond just insuring those without health care coverage. It is about making sure that every American has the peace of mind of knowing that regardless of the situation, they will have health care coverage. This bill is about making sure that those who don't get health care insurance from their employer is able to get it. It's about making sure that insurance companies will not raise your premiums and put you out of coverage if you are suddenly sick and the employer decides to drop coverage. It's about making sure that insurance companies will give everybody a fair chance of getting health care coverage regardless of whether they have a pre-existing condition. It's about making sure that every American has more coverage choices, whether they are working for for an employer, a small employer, or whether they are self-employed. Now, I want to say a few words about what this bill will not do, contrary to much of the misinformation out there. First of all, this bill will not make the government choose your health care for you. You will be able to choose from a wide array of private insurance companies available, as well as hopefully from a public option. But it is completely your choice. In fact, if you like your current plan or your current doctor, you get to keep them. But this is about having an apples-to-apples comparison so that you know what is the best coverage for you. The other thing this bill will not do is increase our federal deficit. The cost of the plan will be paid for fully over the next 10 years, from reducing the waste, fraud, and abuse in the Medicare and Medicaid system, and in having a more efficient system. In addition, there will be a small surcharge on the wealthiest of Americans, but it will not add to the deficit. The other thing this bill will not do is ration health care. Actually, it is our current system of insurance companies approving and disapproving tests that is really the embodiment of rationing health care. And in fact, it is counterintuitive and in fact destructive to have companies that are mainly concerned about the fiscal bottom line making such decisions about which healthcare kinds of tests you would actually get. This bill will actually prohibit companies from dropping your coverage due to a new or pre-existing illness. And finally, I must dispel the most ridiculous rumor of all, that President Obama is doing this healthcare reform so that he can kill off the elderly. Now, this bill will not establish death panels. It will not encourage the elderly to commit euthanasia. This bill is actually about encouraging doctors and patients to do more end-of-life planning. It will compensate doctors to be counselors so that the elderly will have a better plan about what to do in those last years of life. I want to make sure that we do have a rational discussion about this healthcare reform bill. I will work hard myself to make sure that this bill coming out of the House will provide stable coverage that cannot be taken away from Americans, and that it improves what doesn't work, that it keeps what does work, and that it expands our Medicaid eligibility, also that it gives our doctors the best and up-to-date research so that they can provide the best care possible. This is a win-win for everybody, for our doctors, for our government systems, for our, and particularly for Americans. So let's make sure that all Americans are taken care of and that they have the health care they deserve.